University. At this time, we ask that you please silence your cell phones. We also ask that you take a moment to note all emergency exits, both in front of and behind you. Thank you, and enjoy today's event.
Good afternoon, graduates, families, and friends. I'm Dr. Karen Brown-Fackler, and I'm chairperson of the Nursing Department. I'd like to welcome you to the Fall Nursing Symposium, where we recognize our new nursing graduates and welcome them into our noble profession. Graduates, you are prepared to practice as competent nurses within professional performance standards. We hope that you'll continue to make us proud of you as a Saginaw Valley graduate. Please stay in touch and tell us about your career path. And when you're ready, come back to Saginaw Valley to further your formal education in order to expand into teaching or administration or become an advanced practice nurse. We've all heard the saying that it takes a village to raise a child. Well, it takes an awful lot of people to prepare a nursing graduate. The graduates themselves, of course, are probably one of the biggest factors, and then all of their friends and family that provide them with support and love and encouragement. But we also have here tonight a lot of other people who have helped on the journey. We have 21 full-time nursing faculty that I'd like to stand and be recognized, please. There's some over there. They're kind of scattered around. There's some I saw there. We also have a great deal of dedicated staff, professional lab specialists, coordinators, administrators, and other individuals who assist in the preparation of our nursing graduates. Will they please stand? All of our lab specialists, sim specialists, coordinators. Thank you very much. I'd like to introduce our next speaker. Dr. Ava Lewis will introduce the next speaker. Thank you.
Good afternoon. To start our program off, we'll have international domestic nursing experiences presented from an experience in Ireland. That's going to be Christina Deming, Lindsay Weber, and Emma Eldred, followed by Alaska, Sarah Jasowski. China will be Lori Harris, and Zambia, Emily Rose, and Caitlin Getner.
Hello, my name's Emma.
I'm Christina.
And I'm Lindsay.
And we're gonna present, here we go, we're starting off on a good foot. We're gonna present our study abroad in Ireland that happened during the spring break of 2017.
This is the group of students and faculty that traveled to Ireland. We were led by Dr. Beth Rowe and Dr. Karen Brown-Fackler. The group of students included pre-nursing students, nursing students in semesters N2 through N4, as well as some graduate students. This is the group of students along with our tour guide in St. Francis Hospice House in Dublin, where we learned about how hospice services differentiated between the United States and Ireland.
So our trip to Ireland gave us the chance to experience the similarities and differences of nursing in both the United States and in Ireland. While there, we each studied a topic of interest such as maternity, geriatrics, and mental health, which we presented on after returning to the US. We had many opportunities to learn in our journeys throughout Dublin. We began at Trinity College's School of Nursing and Midwifery, where we learned about the educational programs offered there. We explored the differences between the public and private health sectors through our trips to St. Vincent's Private Hospital, the Department of Health, and St. Francis Hospice, and also met with members of the Nursing and Midwifery Board. We were fortunate to have so many opportunities to explore the role of nursing in an entirely new way.
While visiting Trinity College, we had the opportunity to look at the Book of Kells. The Book of Kells is an illuminated version of the manuscript of the four Gospels. It's absolutely beautiful. It's found on their campus. And with that, while in Dublin, we also got to go to what's called an Irish house party. So we were treated to dinner, nice conversation, and Celtic music, which was beautiful. We traveled from Dublin to Galway, and during that travel, we stopped at a farmyard. We got to walk through their farm and meet all of the cute little animals that they had. We also had the chance of learning Celtic dancing and the art of making homemade bread and butter. And the last one, as pictured above, as you can see, is the Cliffs of Moher. These are found on the west coast of Ireland and is one of the most beautiful places that I have ever been.
Another thing that we did while we were there is we participated in a community service project with a group called Humans Too. This is a group of citizens of Dublin that serve the homeless population there. So about 3 nights a week, they make warm soup, hot beverages, sometimes they have fresh sandwiches as well, and they would walk around at night and feed the homeless population. They also had a wagon of donated clothes, which this population could take from as well. And I really appreciated this because it really shows that homelessness is a problem in Ireland as well as the United States. The picture on the left is in Trinity College's library, and this picture doesn't do it justice. It was huge. And then on the right side is Trinity College of Dublin's bell tower on their campus.
Our tour guide quickly became a close friend, and she took us on lots of extra little excursions to some of her favorite places. And one of these was Dalkey, which is a small seaside town just outside of Dublin. And then on the other side of your screen, you'll see a furry friend that we met at the farmyard on our way to Galway. These rocks are pictured by the Irish Sea, and I still have a few of them stowed away at home. And on the other side of the screen, you'll see what Emma described, which is the Cliffs of Moher. And I can attest that this was one of the most breathtaking experiences I've ever had, and taking in God's masterpiece here was incredible.
As Christina mentioned, our tour guide quickly became a friend, and one of the towns that we also got to visit is Bray, Ireland, which is found by the Irish Sea. It's a few 20 minutes outside of Dublin, Ireland by train. Another thing is the Christ Cathedral in Dublin. It is one of the oldest buildings that you can find in that city. And we just want to thank you so much to Saginaw Valley State University for allowing us to go on this trip. We want to thank Dr. Rowe and Dr. Brown-Fackler for joining us and leading this trip and giving us the opportunity to explore Ireland and nursing with them. And especially thank you to our friends and our family for supporting us through this journey. Thank you.
My name is Sarah Jazowski, and I had the opportunity to study abroad in Alaska as a faculty-led study abroad trip in 2017. The trip consisted of nursing and social work majors. It was to study social determinants of health in Anchorage, Alaska. It was a professional study abroad volunteering and educational trip to enhance nursing knowledge and participate in community outreach in underserved and Native populations. Some statistics and facts about this area. The total homeless population in the Anchorage Point in Time survey of 2017 was 1,128 people. Of these, 155 people were unsheltered, 654 resided in emergency shelters, and 319 were in transitional housing. In 2017, the Anchorage Institute for Community Alliance collected data and found 109 individuals voluntarily identified as victims of domestic violence, and 153 individuals voluntarily identified to have a substance abuse problem. And these are the people that have been diagnosed, let alone those that have an undiagnosed problem. Some cultural considerations about this area. It was very important to apply what we learned about culture, therapeutic communication, mental health, and our technical skills of our programs. We really had to develop a rapport with this population as they were very reluctant due to the widespread domestic violence, homelessness, and substance abuse issues. And some of the pictures on this slide are from the Alaska Native Heritage Center. We were shown around by one of the natives about what it was like to live off the land and how they function in their culture. So as part of our community outreach, there were a lot of factors that affected it. There are widespread substance abuse in this area, and Alaska Natives are shunned from their tribes if they have a substance abuse or a mental health issue. Domestic violence plays a very large role in the women and children of this area, And many natives who leave their tribes do not have an education or a home. They're used to living off the land. A spiral of events can lead to homelessness. Poor diet and health regimens present due to unemployment and lack of health, and lack of insurance and resources. Health issues are unable to be resolved. Depression and anxiety present. Substance abuse develops, and the cycle continues. So as part of our community outreach, we volunteered and fundraised supplies for the Native populations at Covenant House, Alaska, Beans Cafe, Soup Kitchen and Shelter, Awake Shelter, which is Abused Women's Aid in Crisis, and Brother Francis Shelter. Donations were collected on campus through the Student Nurses Association and the College of Health and Human Services. We collected socks, toiletries, gift cards, toys, and female hygiene products that were assembled for care packages. And we had 7 suitcases full of care packages to give away. So some of the volunteering, we were unable to take any pictures at any of the shelters due to confidentiality of domestic violence victims and survivors. So the first shelter that we went to was Beans Cafe, Soup Kitchen and Shelter. At first we were able to play bingo with all of the people residing there, and we gave out care package prizes. And this was really just to develop the rapport with these people, to learn their stories and learn about their culture and how they live in this area. Then later in the week, we got to go back and we did blood pressure screenings and mental health and depression and anxiety screenings. And this was just a very emotional experience, as many of these natives learned about very serious health conditions that they had, and they had no insurance and no resources to take care of the things that were going on with them. Next, we visited Covenant House, Alaska, which is a social youth services and housing facility. We bonded with the youth and gave them tips and education on interviewing and applying for jobs, education on healthy meal choices and how to reduce stress. We also were able to just do a lot of activities and tour the facility with them, which was nice to learn about why they were experiencing substance abuse or homelessness or what was going on with them. We also went to Brother Francis Shelter, which was where we aided the natives and those that were present at the blood pressure and mental health screenings to utilize free healthcare services at the clinic. A lot of them were very reluctant to use these services, but luckily we were able to help provide them to them. And then lastly, we went to Awake Shelter, which is the Abused Women's Aid in Crisis place. And there we were able to sort through donations. They have one secretary there that sorts through all the donations, and the boxes were piled up to the ceilings in this room. So this was a huge help for them. Next, we got to participate in children's play. It was just to kind of give the mothers a break. These are all victims of domestic violence that were taking place at this shelter. So it was good to bond with these kids, and we also educated them on proper hand washing and toothbrushing. And lastly, I just want to say a special thanks to Matt Mitchell and Jamie Huffman for making this trip possible. And I also want to thank everyone that donated to these people in need.
Hi, my name is Lori Harris, and in July of 2017, I participated in a faculty-led study abroad experience to Guangzhou, China, with Jinan University. Guangzhou is an urban city in southern China with a population of 14.5 million people. Jinan University and SVSU have a 30-year relationship for these types of study abroad opportunities. We were able to study the Chinese health system for about 7 to 8 days in the first affiliated hospital of Guangzhou. During the time in the hospital setting, we had both teaching and learning opportunities. Here you can see the picture of the hospital, as well as Dr. Berry showing the emergency department nurses and paramedics how we perform CPR in the United States. You can also see Alyssa, the other student selected for the trip, prepared to go into the operating room where we were able to view several surgeries. The intensive care unit was a suite type unit with patients in one room divided by cubicle curtains only. The Chinese cultural belief is that family members take care of their elderly until they get better or they pass away. Therefore, China does not have nursing homes or assisted living facilities. Those who cannot be cared for outside of the hospital stay in the hospital until they are better or until they pass away. One gentleman that we met had been there in the ICU for 267 days. We also learned about traditional Chinese medicine, or TCM. Here you can see the TCM pharmacy and the different bins of natural products used for this practice. The belief is more holistic in nature, and it uses herbs, flowers, mushrooms, plants, and portions of animals as part of the healing process. After the pharmacist packages the items needed, the patients make soup or teas and they drink them. TCM restores balance in the body and provides healing. TCM also includes cupping, which can be seen in the left-hand picture. This increases the blood flow to areas of the body to help with pain. In the right-hand picture, you can see the nurse applying a topical analgesic that was made from plants and herbs. And in the middle, you can see my new friend Ping wearing the traditional dress of the nurses in China. I also was asked to develop and present, through the use of an interpreter, an evidence-based presentation at the 11th International Nursing Forum of Jinan. The room was filled with nursing students and nurses as I presented my research on stress management in the clinical setting. As far as the food go, the people of China believe in using every part of the animal and wasting nothing. And therefore, it was quite normal to see a fish or a chicken head or a foot on a plate of food. And the Barbie that you see there is decorated in fish meat. And we ate that at a hot pot restaurant, which is a very popular restaurant in China. In the lower left, you can see lychee, which are a very popular fruit in China. And we were able to visit a lychee farm and eat them fresh off of the trees. While in Guangzhou, we climbed Baiyu Mountain, we went on a night riverboat cruise, and we visited a tea market. And at the end of our trip, we got to go to Beijing. We visited Tiananmen Square, the Forbidden City, the Summer Palace of the King, as well as the Temple of Heaven. And lastly, I actually climbed and stood atop the Great Wall of China. And I'm unsure that I've ever seen anything quite so breathtaking in all of my life. The trip to China was unlike anything I've ever experienced, with sights and food and hospital experiences. But above all else, the people that I met there were who made the trip worth it. The Chinese hospitality was something far beyond anything I've ever experienced, and I will always remember the trip and hold it close to my heart. A special thank you to those that made it possible. This includes my family for allowing me to be gone for 2 weeks, Dr. Elizabeth Rowe and Dr. Rebecca Toth, and Dr. David Berry for being a wealth of knowledge and for being great travel companions. Thank you to Jinan University and to Saginaw Valley State University's Office of Global Engagement for making it all possible. Thank you.
Hi everyone, I'm Emily Rose.
I'm Caitlin Gettner.
So we were fortunate enough to go on a Zambia study abroad experience this past summer. And just to tell you a little overview. So an overview of our experience, we had a 24-hour flight time one way, over 48 hours to get to Zambia with layovers. We carried with us 18 50-pound duffel bags full of donations and supplies. That's crazy, guys. We arrived in Livingston, Zambia on July 19th, and once we got there, we traveled by bus to the rural town of Mwandi, which was about a 4-hour ride via bus. We stayed at a volunteer camp called Homes for AIDS Orphans for 2 weeks. While we were there, we split up into groups and did daily activities such as visiting schools, elderly residents' homes, building mud homes, and participating in vision and health clinics in a nearby city called Sesheki. We then headed to Botswana on week 3 for sightseeing and excursions, and then we began our long journey home August 7th.
A little overview of healthcare culture in Zambia. It is a universal healthcare system that is grossly underfunded. Many Zambians have poor access to healthcare because they live in rural areas, and there are also tribal influences that impact how Zambians seek healthcare. The population is generally undereducated on disease prevention and safety.
So some prevalent diseases and illnesses that we saw while we were in Zambia were HIV and AIDS, malaria, and tuberculosis. So about 11.5% of Zambians aged 15 to 49 are living with HIV or AIDS at this moment. And it was really interesting. We got to help vaccinate children for things like tetanus, diphtheria, pertussis, measles, mumps, rubella, rotavirus, and polio.
Along with the vaccination clinics, we also assisted with vision clinics. We took an optometrist with us. Her name is Dr. Barb Helms, and she is a friend of a faculty member. We also did mother-baby clinics where we checked babies for growth milestones, public walk-in clinics, malaria testing, and we visited retirement homes and schools where we were able to donate lots of supplies. And then we also helped build mud homes for families that were impacted by AIDS.
So interprofessionalism was a huge part of our study abroad experience. We went along with occupational therapy and health science students, and we worked together to learn about each other's professions and healthcare in Zambia. It was really interesting to kind of widen that scope of practice and be able to work with those other professions.
And then we finished off our trip with some excursions. We traveled to Botswana, where we went to an elephant reservation called Elephant Sands, as well as other safari tours, and we got to visit Victoria Falls, which is one of the greatest waterfalls in the world.
So just a little story of mine. I got to work a few days in the Sesheki District Clinic. I got to work alongside a midwife and did lots of antepartum checks with pregnant women, and I got to do well baby checks, and it was an amazing experience, and it helped me to further appreciate the midwifery scope of practice and Africa's use of resources in general.
On one of the days, me and a group of girls, along with Dr. Helms, our optometrist, and then Dr. Hernandez, the health science professor, traveled over 2 hours on a rough dirt road out in the bush to hold volunteer mother-baby clinics and then a vision clinic, which they hadn't had those resources in a long time. That day, we saw this mother pictured here with her child, and she was concerned about her malnourished baby. So despite the language barrier, we were able to just try to talk to her and educate her and provide vitamins for her baby, which is generally not available in this area in Zambia. So that was just an honor and a moment that I'll never forget.
So lastly, we just want to say a special thank you to our faculty leaders, Dr. Ava Lewis from nursing, Dr. Renee Hernandez from health science, Jill Ennis from occupational therapy, also our special guest optometrist, Dr. Barb Helms, and our supporters, friends and family who donated so many supplies for us before we went on our trip.
Thank you.
Thanks.
We'd like to thank our presenters for those wonderful presentations on their international experiences. At this time, we'll have an honors thesis presentation from Emma Eldred.
As Dr. Lewis said, my name's Emma Eldred, and during this semester of nursing school, I did an honors undergraduate thesis. And my thesis topic was a comparative analysis of 5 Midwestern hospital policies on alcohol withdrawal symptom treatment. Just a little background on why this is the topic that I chose. Alcohol abuse disorder is something that affects 15.1 million adults in the United States. So it's very prevalent in our healthcare system. For those of you that don't know, a person that is diagnosed with alcohol use disorder, when they decide to cease using alcohol, the withdrawal symptoms and the side effects that they exhibit can be life-threatening. And so they often seek hospital help with their treatment methods. In my study, I compared 5 Michigan hospital policies to the most recent evidence-based practice to determine if our Michigan health systems are up to date with the latest evidence-based practice and reasons why they may not be. Looking into the methods, I examined each hospital policy, making sure to look at the medications that they list in their policies, along with the scoring methods that they used. I also looked at how they correlated the different scores with the medications that they used. And then I searched the listed databases that you could see, Cochrane, Medline, CINAHL, looking for those most recent evidence-based practice studies and guidelines. So looking at what evidence-based practice is saying as of right now, benzodiazepines are still the most preferred form of treatment. It's a medication used to treat alcohol withdrawal. Another medication that we can use for additional adjunctive treatment is phenobarbital. Phenobarbital has been shown in studies to be very supportive in the use of alcohol withdrawal symptoms, especially alcohol withdrawal seizures, which some people can exhibit. Dexmedetomidine, or Precedex, is also useful as adjunctive treatment for extreme withdrawal symptoms. However, that medicine needs to be used on an intensive care floor. And so if a patient is being put on Precedex, they would be in an intensive care unit. The last one is that there's no shown better benzodiazepine because there's 2 different kinds. There's long-acting or short-acting. Short-acting is lorazepam or Ativan, which is most commonly used in the hospitals around us. Long-acting would be diazepam or chlordiazepoxide. Sorry. And it doesn't really matter which one you use. The doctors can kind of pick and choose, but if you are to use a long-acting, they like to use fixed scheduled dosing, so they're going to receive it 8 times a day no matter what, whereas lorazepam is used based on when they start to exhibit those symptoms. So when we're looking at our hospital policy compared to the most recent evidence-based practice, I numbered the hospitals 1 through 5 for them to remain anonymous. Hospitals 1, 2, and 5 seem to pair really well with our most recent evidence-based practice, but when it comes to using phenobarbital in their policy and Precedex in their policy, Hospital 3 starts to kind of fall behind, and Hospital 4 also doesn't use phenobarbital. So what could that mean? One of the things that I looked into is socioeconomic factors. I looked at the hospitals 1 through 5, and I ranked them if they were rural or urban based on how many beds that these hospitals had. Not the towns that they're in, the hospital itself. So a rural hospital would be any hospital that's bed count is under 400. Hospital 1, 3, and 4 would all be considered rural hospitals. As you saw earlier, 3 and 4 seem to be the ones that could have a few advancements to make. Rural hospitals, for this reason, receive less reimbursement because they're smaller, and so they don't get as much money back as some of our larger health systems in the state would have, putting them at a disadvantage for research. Rural hospitals also have less disposable income that they can use to put into research. They usually put it in things like new technology or those kind of things that can help advance your health care. So in conclusion, we're looking at those hospitals 1, 2, and 5 that conform to the most recent evidence-based practice. The smaller hospitals do have a few steps to make in their healthcare advancement, but part of it could be because they lack that disposable income. However, we need to keep in mind that medications could be included in their order policies that are not listed in their actual written policies found in these health systems. I collected 9 hospital policies and can only compare 5 since 4 of them were lacking those comparable factors. And then different doctors prescribe differently. And so a doctor can prescribe something that's not labeled in the policy to keep up with best practice. It's just not in their policy. So what does that mean for us as outgoing new grads? We need to make sure that our patients are receiving the very best care. We are now responsible as new grads to keep up with the best practice, and we need to advocate for the very best care and push forward to, in turn, provide that best care. And I just want to thank Dr. Brown-Fackler, my advisor, for helping me through this little challenge of this semester, and my friends and family for supporting me through all of the hard work. So thank you.
Thank you, Emma, for that very interesting presentation from your thesis. At this time, we will call our dean, Dr. Judith Rulin, forward, and she will bring us the symposium address.
Thank you, Ava. Good afternoon, and congratulations on achieving this wonderful moment. Your accomplishments to bring you to this evening are impressive. Some of you are just beginning your careers with jobs in hand, and others are still looking for just the perfect position. Others of you have finished the next step in your professional ladder of achievement to move to the next level of professional accomplishment, one that will take you to places that you have yet to even imagine. Your hard work over the past several years will pay you back tenfold. You are all at a pivotal moment in your lives. So many plans and so much excitement as you leave these corridors to head out to accomplish all that you've been preparing for these many years. So as you start or continue your careers, what can I tell you that you will remember and might help you as you leave here tonight? What do I even remember about my pinning or graduation ceremonies? Nothing, actually. Except that all my good friends that I was about to leave and the dread I felt for heading into unknown territories. I do remember, however, a lot about my first weeks of work at the VA hospital in 1970. Ooh. I had been hired, and I thought I was going to work on a surgical unit. That's what they had told me. But due to a vacancy, I wound up on a neurological unit, and it was filled with something you probably don't even know about, but iron lungs and many comatose patients and many young men who were really unhappy to be there. Some were just a little bit older than me and pretty angry at the world for having come back from Vietnam with brain injuries and were living life in a very different way than they had been before they left. I, on the other hand, was so excited to be a nurse, but so unhappy in my self-centered little way about the placement on this particular unit where people could either not talk to me or wouldn't talk to me. So I'd hit a little roadblock in my Pollyanna plan. And in hindsight, I realized what was really wrong was that I was afraid. But I couldn't see it then. I didn't think I was afraid. I just felt like they had put me on the wrong unit. And all I could see was that it wasn't my plan. This wasn't what I had planned to do upon graduation. This was a job that was supposed to be my be-all and end-all, and it just wasn't it. So my plan wasn't coming together. And that's the thing about plans. Sometimes they don't just happen as you think they might. One of my primary assignments on this unit was to care for a young man in an iron lung because he had fractured his neck. And he was so angry because he was in this situation. So he spent most of his day swearing at his caregivers. I was one of those caregivers. And I was scared to death and very unhappy to be assigned to him because I was afraid of him. I was a new kid, and so I was therefore assigned to this patient. It was kind of like a rite of passage on that unit. Each night, I would come home from what was supposed to be my perfect job and carry on to my parents over dinner about ain't it awful, you know how that goes? And so about all the awful things in the work situation that I was supposed to be in that was supposed to be so good. So in fact, I was pretty self-centered all along. My dad, careful not to say anything that was going to get me too red-headed tempered, he would talk to me about what was I doing to make it better. Each night, as I was griping about all the bad parts of each day, like trying to change a sterile dressing through a porthole in an iron lung, while a wise-mouthed 25-year-old was telling me I wasn't doing it right. He was one of those, angry at the world folks. My dad would ask me, well, Judy, how do you think he feels? He suggested that if I just worked harder and was kind to this young man, amazing things would probably happen. I probably said, "Yeah, right, Dad." I don't remember exactly what I said. His comments and little questions like that I didn't really want to hear during my self-centered ranting and raving, or he would say to me, "How are you going to accept the fact that that's your assignment, Judy? Make the best of it and see what it brings to you." Because, he said, generally in life, the things that do not go according to your plan are often the very things that lead to other things going well. He was a big believer in improvisation, and that all new professionals, regardless of one's educational training, must rely on that to a good extent. He suggested that I look for commonalities in our lives. At one point he said, "Jack's a mechanic, right?" I said, "Yes." He said, "Well, have you brought in a picture of your little car?" I had a little blue Austin Healey Sprite, tiny little thing. And he thought I ought to bring it in and show it to Jack, the picture of it. And then he said, "Maybe you could play your music for him, that crazy music of yours." He meant the Motown I played in my car every day to work, the Temptations and the Four Tops. Again, you don't know them, but they were big at the time. So I followed my dad's advice. And as it turned out, Jack and I created a great relationship. With this very difficult to deal with young man, all of a sudden, we developed a relationship based on commonalities between us. And over the next 3 months that I was routinely assigned to him, and by me having the courage to go into an unexplored territory, I was able to demonstrate to myself and to the head nurse on my unit that I was actually able to cope and to think creatively and work outside my comfort zone. And for the first time in a year, Jack began to not spit out his meds and to be compliant with his medication regime. He started to eat, and he stopped acting out in negative ways. We really connected, and I couldn't wait to get to work every day. And I stopped acting out and realized that when you get to work, you take the assignment you're given, and the little plan you had may not be perfect, just go with the flow. And at the end of the 4-month orientation period, I was offered an opportunity to take a critical care course. I was afraid to do it, but I did it, and all of a sudden, at 6 months, I was one of 2 nurses at the hospital who went on to be able to open a coronary care unit at the VA. This is back in 1970. We didn't have those, but I was offered the opportunity to do that. But I never stopped coming to see Jack. I even brought my kids to visit, and we continued to visit him until he died. We both mattered to each other in our journeys. So the moral of this story is that in life, you may not always get what was your prescribed plan, or life may not turn out exactly as you hoped. But you will never know what's around the corner if you don't peek, and if you're not willing to take risks. Sometimes the ones that you least expect are the ones that bring you the greatest rewards, especially in nursing. I'll never forget the moments that the 2 of us shared as I learned from him in my first 4 months as a nurse, doing nothing that I had expected to do, yet learning more about myself and nursing than I'd ever imagined. So as you all head out the door with the plan that I know is in your head right now, I encourage you not to let your fears overwhelm your desires, and let the barriers that I know you're going to face be only external ones, not internal ones. You need to trust that you are well prepared, because I know you are, and just have the courage to face what comes your way as a strong cardinal that you are, and be ready to fly. One thing I hope you've learned at SVSU is that whatever blocks you encounter, you have learned there's a way over them, around them, and through them. It's not the obstacles that'll inhibit your progress, but your confidence. And you can break the inertia of fear and doubt just be relying on what you know. So enjoy this next week of freedom and graduation and celebration. And as you go forward to learn from your everyday practice, I hope you'll find nursing just as much fun as I have for the last 40-some years. And when you are ready to come back to graduate school, as Karen Brown-Fackler said, we hope you'll come back to us and consider us for that purpose, or just for references, or just for guidance in where you might go. Don't forget us. Join us for football games, continuing ed conferences, or just to chat. We are your college and university, and we're your friends. We'll always be here for you. So please come back right here tomorrow night for graduation with your families. We'll be hopeful to see you. Thank you.
I'd like to thank Dr. Rulin for those very wonderful words of encouragement. At this time, we'll have the transition to BSN from Kelly Warner and Debbie Shamo, followed by the student nurse to graduate nurse presented by Emily Rose and Liz Stokes.
Hi, I'm Kelly Warner,
I'm Deborah Shamo.
and we're going to do a quick little synopsis of our journey from the RN to the BSN program. So in the beginning, it was all exciting. We got those new syllabus, those new books. Most of us rented them. They're not brand new. Learning new ideas, concepts, advancing our knowledge base.
We're so excited, and then reality hit. Whew, we have families that all of us are working mothers and fathers that we had to start juggling. We became kind of a circus act. And then we all had the school that we had to fit into all the life that we had already. And then finally, the finances that we all had to incorporate also into our lives.
Some valuable lessons that we learned along the way were the feelings of accomplishment that I think we all shared. Some new friends, new ideas, learned how to write some papers and research.
Just a couple papers. Not very many. So this may be the end of our BSN degree, but it's only the beginning of a new journey in our lives, of their careers as nurses.
Our advice for any of you new RNs out there, we hope that you put self-care as a priority in your lives when you move forward into your nursing career, because I promise once you do, you will provide the utmost compassionate care to your patients and families. Thank you.
Hi everyone, Emily again.
Hi, I'm Liz Stokes. Thank you for coming to this celebratory event. We're so proud to be up on this stage representing such an accomplished nursing cohort. As most of you know, we have all gone through the 5 semesters of nursing school, not without difficulty, not without moments of doubting ourselves, but also with moments of hysterical laughter, building friendships that will last, and a realization of our true potential in the field of nursing. Without further ado, join us in the many emotions we have all faced throughout this crazy little thing called nursing school. Our skit, Drama Queens of the Class of 2018.
Let's start off at N1. OMG, Liz, I just got my scrubs today. I'm officially a nurse.
I can't believe this is real. It seems like just yesterday we were trying to figure out the minimum score we needed to pass our micro final.
That's for sure. Have you heard anything about checkoffs from previous students?
Just basically that we can always count on coffee and to mentally prepare for multiple emotional breakdowns, but also that studying for med admit is comparable to the anxiety a person would get right before skydiving.
Forget med admit. Have you looked at the syllabus for health assessment?
Yeah, I think I'm going to be using my stethoscope a lot before head-to-toe checkoff.
2 beating checkoff and 2 finals in 1 week? I can't believe we actually did it.
I'm ready to have a life again. Let's move on to N2. We're in the same clinical group. I'll finally get to use a Foley cap on a real person.
That's what you're excited for? Think about it. We get to give injections now.
With actual needles.
Liz, I might actually go crazy with excitement.
If you actually go crazy, we'll be assessing you.
Well, it can't be any harder than N1.
Let's not talk about that.
On the bright side, I heard N3 is different with public health and home care. Are you ready to break out our favorite polos again?
Yes, and everyone loves a straight leg khaki, am I right? I can't wait to go to the jail.
Are you serious, Liz?
I may find my true calling.
You mean behind bars?
Ha ha. But really, all I want to do is learn about babies.
Me too, but let's make sure we know our vaccine schedules before we jump into OB.
And on that note, vaccinate your children, folks.
Just wait till N4, Liz. We'll be in baby heaven.
Finally, this will be my semester.
Wow, Liz, I've never seen anyone get so excited just from talking about changing diapers.
Come on, Em, you know you love it.
When's your OB rotation?
Not soon enough, let me tell you.
I'm not sure everyone else is as thrilled as we are.
I've never been so excited to read a book, Maternal Child Nursing.
I'd rather read Dr. Seuss to our pediatric patients.
OB, DMC children, so much is happening this semester. I can't believe we're almost there.
I can't believe everything's finally clicking. N5, here we come. Have you started applying for jobs yet?
Only at every hospital system in the state.
Well, maybe I'll get some use out of this portfolio. They can't turn us all down with these fancy folders.
Before you know it, we'll all have jobs. Maybe.
Yeah, right after we finish 177 hours of leadership, 48 hours of critical care, that 40-page essay, 3 exams, 2 Hessies, 1 cat, and a partridge in a pear tree.
Yeah, good point. I may need to break out my friend Red Bull to get me through these last few months.
Just think, after these few easy assignments, all we have left is the NCLEX.
Only 106 days left, right?
Present? Do you want to do the present now?
No.
Okay. Now, with only 1 day left until we walk across the stage to receive our BSN diploma, we leave you with this. From our pre-nursing requisites to the anxiety-ridden nursing application day, getting accepted into the program, facing the diverse challenges of each semester, until now, we made it. We've made new friends, shaped new minds for ourselves, learned the importance of caring for those who are at their worst and those that may be at their best. We've had the opportunity to create relationships with our cohorts, our professors, clinical instructors, and patients. And throughout all of this, we've become the kind of people that not only save lives, but transform them. To those going away and those who have chosen to stay, always remember what brought you to this point and never stop striving to become even better than you are now. Here's to 2 years of happiness, frustration, triumphs, and failures. Never forget those who held our hand, were a shoulder to cry on, and those who never failed to make us laugh. Here's to the graduating class of December 2018. Here's to us. I feel like we shouldn't.
No, we have to do it right now. We already said we would.
Okay, go for it.
So we have a special surprise for 2 people in our audience who have been a huge help to us this past N5 semester. Could Professor Fabreau and Dr. Frederick come up to the stage for us?
Where are they?
If they're not already up here. So as many of you know, or don't know, this has been a very challenging semester in N5, and we possibly could not have done this without Dr. Frederick and Professor Fabreau. So we'd like to present them with these personalized gifts to let them know how much we appreciate them. Thank you so much. You've really made a difference and helped build us into the nurses we are today. Thank you.
We'd like to thank our RN to BSN presenters, Kelly Warner and Debbie Shamal, as well as Emily Rose and Liz Stokes for their skit and the video presentation. At this time, we're going to have the SVSU nursing pens presented, the history of the pen by Madison Moore and Jack Dooley, followed by recognition of the RN and graduates by Dr. Dave Peruso.
Thank you all for being here with us this afternoon as we share our journey through nursing school with you and celebrate our transition from students to registered nurses. The tradition of the nursing pin began with Florence Nightingale, who was the pioneer of the nursing field. A pin was given to Florence by the military in order to commend her for her service to them. She then designed her own pin to be given to other nurses for their services. This began a tradition that was carried on by many nursing schools and is still continuing today in some schools. The pin we will be wearing today was designed by Roberta Kripe, a student from the first graduating class of Saginaw Valley State College School of Nursing in June of 1979. The triangle on the pin symbolizes the Tri-City area, Saginaw, Midland, and Bay City, that surrounds Saginaw Valley State. The dove and olive branch was chosen by the first graduating class as a symbol of peace because they felt that nursing was a peaceful art. Red was chosen as the color because it is the official color of Saginaw Valley State University.
Honored guests who will be assisting with the pinning today include Margaret Francina, Heather Kruger, Sharon Panapucci, Molly Stapish, Art LaForest, and many others.
Good evening. We will begin the recognition of our RN to BSN students. But before we do, I just want to take a couple of minutes to recognize their endeavors. Many of these individuals, as was pointed out in the presentation earlier, have had to balance work, family, and actually returning to school after being out for many years. But they made a conscious decision to return and to complete their bachelor's degree. The reason for them doing this could be for many reasons. However, regardless of the reason, they made that commitment to complete their degree. Several of our graduates have also come from Nepal and have successfully completed the NCLEX exam here in the United States, and then immerse themselves into our educational system, and today have completed their BSN. And finally, we also have another group of RN to BSN students who have actually attended 2 colleges at the same time. They were concurrently enrolled at a community college, either Kirtland or Delta College, and they also took classes while attending their community college here at Saginaw Valley. So it really is my pleasure to acknowledge their accomplishments that they have done over this time period. Randy Bauman. And his leadership project was updating a policy to clarify the discharge process. Randy would like to thank his family, especially his wife, for their support in him while he was achieving his educational goals. He would also like to thank the faculty here who helped him throughout his journey, and a special thanks to Reggie Call, Geisha Walter, and Debbie Gibson. Jacqueline Butson. Her leadership project was combating MRSA with chlorhexidine. And Jacqueline would like to thank her husband, family, and friends. She would not have been able to do this without the love and support that they showed along this journey. Manuka Chaudhry. Her leadership project was guided peripheral IV insertion. She would like to thank her parents for showing her the right path, and she is also thankful to her husband and her child, she has a daughter who's 6 years old, and also a newborn infant that she had just in the past couple of months. And she is also thankful to SVSU for providing guidance and caring. Andra Cooley. Her leadership project was ED Mini Simulation. She would like to thank her husband, Jason, who is also an RN, her sons, Alex, Zach, Eric, and Zeke, as well as her parents, Mark and Rosalie, her sister, Ashley, Joanne, and her in-laws, Shelley and Chuck. Morgan Damvelt. Her leadership project was a fall safety plan. And she would like to thank her family for helping and supporting her through this journey. Paula Grizek. Her leadership project was revised and combined close observation and video monitoring policy. She would like to thank her husband and daughters for their understanding, patience, and support during this journey. She also wants to thank her classmates for the teamwork that makes this dream work. Sean Lackey. Her leadership project was a proposal for unifying and streamlining the nursing orientation process. She would like to thank her husband, for without him, she would never have completed this. Heather Kruger for being the person she has always wanted to be, and my proofreaders, Quinn and Madison. Victoria Likovic. Her leadership project was implementation of individualized patient alarms to increase patient safety. She would like to thank her mother for her endless love, support, motivation, and education. All of my family for tolerating her demanding schedule over the years and loving her unconditionally. They are all wonderful. Lisa Peruski. Her leadership project was advanced care planning. She would like to take this time to thank her boys, Hunter and Griffin, for all the sacrifices that they had to make during her journey to get here. Devin Matsumiya. Her leadership project was an education piece on an AED locations at Covenant and what to do when an arrest happens off the unit. She would like to thank her amazing family for all of their ever-ending love and support, her cats for their stress-relieving cuddles, and lastly, her wonderful boyfriend for just being him and for loving her. Emily Nelson. Her leadership project was created and presented health department services and reproductive health education to teens in foster care. She would like to thank her husband, Danny, for always supporting and encouraging her dreams, and her mom, Ann, for always keeping her going even when it seemed impossible. Jory Reeder. Her leadership project was pelvic fracture trauma scenario, and she would like to thank her husband for above and beyond support during this whole journey. Todd Rouse. And he did his leadership project with early mobility in the intensive care unit. Caitlin Schreiber, and her leadership project was Revised Covenant Healthcare's Policy and Clinical Practice Guideline for MEWSC Modified Early Warning System. And she would like to thank God, her family, for their unconditional support and encouragement, her son Noah for the inspiration, and her classmates for sharing this journey. Deborah Ann Shamel. Her leadership project was development of a simulation to include a human trafficking aspect. She would like to take this time to formally thank her husband, Sean, her children, Sophia and Carmen, her parents, Ward and Nancy. They have been by her side, supporting her through this entire RN journey, and she could not have done it without them. She thanks them and loves them. Mina Sidell. Her leadership project was catheter-associated urinary tract infection. She would like to thank her family and friends who supported her to achieve this goal. She would like to thank the SVSU faculty. They provided such a homey environment. I am blessed to have a supportive husband who always gives motivation for me to move forward and to achieve my goals. Sabina Tamang. Her leadership project was Central Line Associated Bloodstream Infections. She would like to thank her family, who is millions of miles away from me. However, from her, SVSU faculty, her brother Raj, her friends, and someone special who helped me throughout this journey and made it possible. Sonia Thampa. Her leadership project was also catheter-associated urinary tract infection. She would like to thank her parents, without whom it would not be possible. It was her father's dream to see her become a nurse, and his dream became mine. She would also like to thank the faculty members and, of course, Dr. Judy Ruhlin for all of her help and support and encouragement. Shannon Thompson. Her leadership project was IV concentration meds. She would like to thank Andrea Frederick, her family, and God for sustaining her through this crazy journey. She also would like to thank her Delta professors, Beth Zeman and Daisy McQuiston. Are you out there? Okay. Heather Virrell. Her leadership project is Performance Management Systems in Public Health. She would like to thank her family for supporting my goals and dreams. Tim and I couldn't have done it without you. Kelly Warner. Her leadership project was purposeful hourly rounding, and she would like to thank her husband, children, and parents for all of their support and cheering me on when she thought she couldn't do it anymore. So we can give them a nice round of applause. Now the BSN students will be presented, and is Mindy? Oh, Becky Toth will be doing the first set of introductions.
First, we have Sarah Michaela Akers. She was at Children's Hospital of Michigan on the Burn Rehab Unit. Her first RN position is at Children's Hospital of Michigan in Detroit in the Pediatric Intensive Care. She graduates with honors as the former vice president of SVSU's Student Nurses Association. Sarah would like to thank her amazing parents, sister, fiance, families, and friends for the constant love and support. Congratulations, Sarah. Justin W. Babcock. His leadership was at Hurley Medical Center in the ICCU. Justin would like to thank Lori Harris, Carly Ware, Emma Eldred, John Murray, Lorenzo Marco, Jeremy Johnson, and the professors. Congratulations, Justin. Rebecca Barger. Her leadership was at Covenant Healthcare Cardiac Progressive Care Unit. Her first RN position is at Children's Hospital of Michigan, Detroit in the Neonatal Intensive Care Unit. She graduates summa cum laude. Rebecca would like to say thank you to God, her friends, her family, her mom, dad, Allison, Anna, Daniel, Samuel, and my Aunt Ann for loving and believing in her. Krista L. Barnett. Her leadership was at Mid-Michigan in the Neuromedical Unit. Her goal is to obtain a position at Hurley Medical Center. She graduates cum laude. Krista would like to thank her family and friends for all their love and support. She also wants to thank her roommate, best friend, and nursing school partner in crime, Alyssa. Alyssa Barnhart. Her leadership was at Hurley Medical Center, Labor and Delivery. Her goal is to obtain a position at Hurley Medical Center or Genesis Hospital. She graduates cum laude. Alyssa would like to thank her friends and her family. Special shout out to Krista. I couldn't have done it without you. Congratulations, Alyssa. Amanda Blanchard. Her leadership was at St. Mary's Trauma ICU. Her first RN position is at St. John's Stroke Unit in Tulsa, Oklahoma. Amanda would like to thank her grandmother for inspiration, her mother for support and pushing her, her husband and 4 amazing children, Gabriel, Hayden, Rowan, and Sophia, for constant love, support, and understanding. She loves you all very much. Congratulations, Amanda. Nate Bob. Nate Bob did his leadership at McLaren ICU. His first RN position was accepted at Children's Hospital of Vanderbilt in the Pediatric ICU. Nate would like to thank his family for being the greatest support during this journey. To the lab staff, he will always be thankful for being a part of your team. And to his SVSU friends, these truly were the good old days. Congratulations, Nate. Andrea Boehm, her leadership was at St. Mary's in the cardiac step-down unit. Her first RN position is at Covenant on the orthopedic unit. She graduates magna cum laude. Andrea wishes to thank her husband, her kids, her parents, her sister, and her in-laws. Congratulations, Andrea. Rachel M. Byron, she did her leadership at Hurley Medical Center in the CCU. Her first RN position is at the University of Michigan Emergency Department. She graduates magna cum laude, Sigma Theta Tau Nursing Honor Society. Rachel would like to thank her parents, brother, boyfriend, family, and friends for supporting her throughout nursing school. She also wants to thank her preceptor, Melissa, for helping her grow as a nurse. I love you all and could not have done it without you. Congratulations, Rachel. Erin S. Carter, she did her leadership at McLaren Bay Region in orthopedics. Her goal is to obtain a position in pediatrics, and she would like to thank her mom and dad. Congratulations, Erin. Stephanie L. Carter, her leadership was at Beaumont Royal Oak in the cardiovascular SICU. Her first RN position is at Mid-Michigan Health in the general surgical unit. Stephanie would like to thank her family for supporting her throughout this journey. She could not have done it without you. Congratulations, Stephanie. Sarah Cavazos, her leadership was at Hurley Medical Center Emergency Department. Her goal is to obtain a position at Hurley Medical Center in the emergency department. She graduates magna cum laude. Sarah would like to thank her husband, Alex, for his endless love and encouragement during this journey, her sister, dad, and mom for their support and believing in her, and her many friends and family for always being there to help. Congratulations, Sarah. Colin M. Crane, his leadership was at Covenant Progressive Care Unit. His first RN position is at Marquette General Hospital Emergency Department. Colin would like to thank his parents for supporting him emotionally and financially, his nursing friends for keeping him focused and always challenging him to do better, his sister for always encouraging him and folding his laundry, and for his other close friends and family who've helped him to succeed. Congratulations, Colin. Caitlin M. Kraus, her leadership was at Mid-Michigan in the General Medical Surgical Unit. Her first RN position is at Mid-Michigan on the General Medical Unit. She graduates cum laude. Caitlin would like to say thank you to her family and friends for supporting her throughout the college experience. Congratulations, Caitlin. Constance C. Kumper, her leadership was at Covenant Healthcare in the Progressive Cardiac Unit. Her first RN position is at Munson in the Medical Surgical Unit. Constance would like to thank her family, friends, and her dogs. Congratulations, Constance. Caitlin M. DeBaney, her leadership was at Henry Ford in Detroit. Her first RN position is at St. John Providence Macomb in the Intensive Care Unit. She graduates cum laude. Caitlin would like to thank her parents, brothers, and grandparents for all the love and support they've given her every day, and her friends for all the fun moments and study sessions. Congratulations, Caitlin. Travis M. Delaney. His leadership was at McLaren Bay Region on 4 West. His goal is to work in an ICU. Travis would like to thank his friends, family, and girlfriend for always supporting him. Congratulations, Travis. Christina Deming. Her leadership was McLaren Thumb Region Emergency Department. Her first RN position is also at McLaren Thumb Region on the Medical Surgical Unit. She graduates summa cum laude and Foundation Scholar and SNA Student Nurses Association Secretary. Christina would like to thank the Lord, her husband, and her family for their endless love, support, and encouragement. Christina would not be here without all of you. Congratulations, Christina. Jessica Dodd. Her leadership was at Mid-Michigan Medical Center in West Branch. Her first RN position is at Mid-Michigan West Branch as the surgical unit intern. She graduates cum laude. Jessica would like to thank her 3 amazing preceptors, Danielle, Emily, and Pam, as well as the West Branch ER nurse manager. Jessica is so grateful for all of her family and friends' support to pull her through this stressful adventure, especially her fiance, Will. Congratulations, Jessica. John Dooley. His leadership was at Mid-Michigan Clare in the emergency department. His goal is to obtain a position at University of Michigan Ann Arbor or Northwestern in Chicago. He graduates summa cum laude. First, John would like to thank all of his clinical instructors, Kara Withers, Mindy Fabro, Chad Panic, and Cece. He would also like to thank his parents for not picking up the phone on exam week when he wanted to change his major. We thank you for that too. Congratulations. Anne-Marie Dunneback. Her leadership was at Covenant Healthcare Cooper in the Progressive Cardiovascular Unit. Her first RN position is at Sparrow Health in the Cardiac Step-Down or Neuro Step-Down. She graduates summa cum laude and a member of Sigma Theta Tau. Anne-Marie, to her family, says thank you for your unceasing love and support. To her friends, thank you for making this journey so wonderful. And to her instructors, thank you for sharing your experience to help us be our best. Congratulations, Anne-Marie. Precious G. Dunson. Her leadership was at Hurley Medical Center Rehab. Her goal is to obtain a position at Hurley Medical Center. Precious would like to thank her loving and supportive boyfriend, Shane, my mom, Monica, best friend, Tamika, and a host of aunts, uncles, and close friends. Congratulations, Precious. Emma R. Eldred. Her leadership was at Mid-Michigan Health Gratiot ER. Her first RN position is also at Mid-Michigan Health Gratiot ER, and she graduates magna cum laude. Emma would like to thank her family and friends for their endless support, as well as those who have bought me coffee and/or snacks. John Andrew Drew Emmerich. His leadership was at Mid-Michigan Gratiot in the ED. His goal is to obtain an emergency room and critical care and pursue flight care. He graduates cum laude in the graduating class of December 2018 Student Development Committee. Drew would like to thank faculty, especially Dr. Decker, Dr. Toth, Dr. Huffman, his peers, most notably Mads, Darbs, AT, and Lori. Finally, his family, parents, friends, and especially his biggest supporters, Abby, Eli, and Lydia. Thank you. Congratulations, Drew.
Monica E. Falls. Her leadership was at Covenant Healthcare Neurotrauma Progressive Care Unit. She has accepted a position at Beaumont Hospital Neuroprogressive Care. She graduates cum laude, recipient of the SVSU Founders Scholarship, a member of the Student Nurses Association. She would like to thank her parents for giving her the opportunity to receive a college education. She would also like to thank the friends she has made in nursing school for making the past 2 years so memorable. Congratulations. Heather Rose Fitzgerald. Her leadership was done at Henry Ford Health System in Detroit. Her goal is to obtain a position at Beaumont Royal Oak in pediatrics or orthopedics. She graduates cum laude. She would like to thank her parents, Tracy and James, sister Shayla, boyfriend Adam, and best friends. Your overflowing love and support has guided her in achieving her dream of becoming a nurse. Congratulations. Ilion Flakel. Her leadership was at Mid-Michigan Gratiot. Her goal is to obtain a position at Helen DeVos Children's Hospital in Grand Rapids, Michigan as a pediatric nurse. She would like to thank her fiancé, Lucas, her daughter, Reagan, and her parents for their constant support and motivation. Congratulations. Caitlin M. Franzik. Her leadership was at Mid-Michigan Medical Center in Midland, SICU. Her first RN position has been accepted at Mid-Michigan Medical Center Midland, Surgical Intensive Care Unit. She graduates summa cum laude and would like to thank her parents, her dog, her ICU preceptors, her N1 clinical group. She is so thankful for online shopping and express shipping. Congratulations. Caitlin M. Genter. Her leadership agency was Marlette Regional Hospital Acute Care. Her first RN position is accepted at Mackenzie Health System Acute Care and Emergency Department. She graduates cum laude and would like to thank her husband, Matt, her family, her friends, and her wonderful preceptor, Danielle. Congratulations. Next, we have Haley M. Green. Her leadership agency was Covenant Surgical Intensive Care Unit. Her first RN position has been accepted at St. Joe's Ann Arbor Progressive Care ICU Step Down. She would like to thank her family for always supporting her and giving her the motivation to complete nursing school with a strong mindset. Congratulations. Megan M. Gentler. Her leadership was Mid-Michigan Midland Specialty Surgery Unit. Her first RN position has been accepted at Mid-Michigan Alpena Medical Center on 3 South. She graduates with honors magna cum laude. She would like to thank her fiancé, Gavin, and her parents for their continuous support. Also, her friends and other family members that were there for her along the way. Congratulations. Elizabeth M. Gugliami. Her leadership was at McLaren Bay Region on the Cardiac Step-Down Unit. Her first RN position has been accepted at Mid-Michigan Medical Center Midland, General Medicine. She graduates summa cum laude and would like to thank her mom and dad for making her dreams become a reality. She is where she is today thanks to your love, efforts, and sacrifices. She is so grateful to have amazing parents like you and cannot thank you enough for all you've provided her in her life. She loves you. Congratulations. Lori D. Harris. Her leadership was Mid-Michigan Medical Center Midland, NTICU. Her first RN position will be at Mid-Michigan Medical Center Midland in the NTICU. She graduates summa cum laude, a member of Sigma Theta Tau Nursing Honor Society. She would like to thank her husband Joe and her girls, Dalen and Avery. You are her everything. Also, she would like to thank her family and friends for their support that has been invaluable. Her fellow nursing grads, she owes a thank you for accepting and loving her as she is. She says, no days left. Congratulations. Allison P. Hart. Her leadership was at St. Mary's of Michigan in the emergency room. Her goal is to obtain a position in the emergency medicine department. She would like to thank her friends and family, especially her mother, Corina, for answering all her phone calls, her sister, Kayla, for being a constant positive influence, her roommate, Ari, for dealing with a student nursing brain, and all the new friends she created here. Congratulations. Julie Hoaho. Her leadership agency was Covenant Resource Team. Her goal is to obtain a position at the Veterans Administration, working with veterans. She would like to thank her fiancé, Jericho, and his whole family, who have been supportive through this journey. She'd like to thank her mom and dad, Coffee, her son Jace, who kept her motivated and always focused. Congratulations. Ashley M. Housen. Her leadership was at McLaren Bay Region on 4 West. She has accepted a position as a resource nurse on the OB team at Mid-Michigan Health. She graduates cum laude and would like to thank her parents, her brother Michael, her boyfriend Stephen, and her family for the endless motivation, support, and love they've given her throughout nursing school. Congratulations. Natalie A. Janes. Her leadership agency was Royal Oak of Beaumont, SICU. Her first position has been accepted at Troy Beaumont in the SICU. She graduates summa cum laude, Sigma Theta Tau member, and would like to thank her family, friends, and boyfriend for their continued love and support. Congratulations. Sarah E. Jazowski. Her leadership was at Covenant Healthcare in the CVICU. Her first RN position has been accepted at Covenant Healthcare in the cardiovascular ICU. She graduates magna cum laude and would like to thank her mom and dad, grandmother, grandfather, and friends for all their support over the years. She loves you guys. Congratulations. Jeremy D. Johnson. His leadership agency was Hurley Neurotrauma ICU. He graduates summa cum laude and would like to thank his mother and father for their support in all aspects of his life, as well as the entire cohort for the friendships and memories made in the last 2.5 years. Congratulations. Megan E. Kennedy. Her leadership agency was McLaren Bay 6 East. Her goal is to get money to actually take the NCLEX. She would like to thank her parents for not killing her when her stress made her as friendly as a rabid badger. She would like to thank her brother for being her personal editor, and she's sorry for being so dyslexic sometimes. Congratulations. Riley E. Canoop. Her leadership agency was Mid-Michigan Medical Center Progressive Care Unit. Her goal is to provide compassionate care wherever she may go. She graduates cum laude and would like to send a huge thank you to all of her friends and family, especially her mother and father, who have always encouraged her and taught her to trust the journey. Congratulations. Janelle E. Lepic. Her leadership agency was Hills and Dales General Hospital on the medical surgical floor. Her first RN position has been accepted at Mackenzie Health System Emergency Department and Medical Surgical Unit. She graduates magna cum laude and the former treasurer of SVSU's Student Nurses Association. She would like to thank her mother, father, fiance, family, and friends, especially Sarah and Sam, for all their support and love. Congratulations. Ariana A. Laville. Her leadership agency was Covenant Healthcare Cardiac Step-Down Unit. Her first RN position has been accepted at Covenant Progressive Cardiac Care Unit. She graduates magna cum laude. She would like to thank her dad for making this achievable, possible, and believing in her when she didn't believe in herself. Her mother for the constant support, and her nursing friends for making this experience so memorable. Congratulations. Caitlin M. Lipensky. Her leadership agency was Covenant Healthcare. Her first RN position has been accepted at Beaumont Troy Med Surg. She graduates cum laude and would like to thank her friends and family for all their love and support throughout nursing school. Congratulations. Adam M. Majewski. His leadership agency was Henry Ford in Detroit. His goal is to obtain a position at ICU in the Metro Detroit area. He would like to thank his mother and father for all the support, encouragement, and wise words to help him get along this wild ride. He would also like to thank nursing professors for being so supportive and openly available for help. And lastly, thank you to everyone. He says, it's been real. Good luck. Congrats. Lauren Marcoux, leadership agency was Beaumont, Royal Oak. PEDS emergency room. Goal is to obtain a position in Ann Arbor area in a med-surg unit. Graduates magna cum laude, and would like to thank family, friends, and faculty. Congrats. Sydney E. McConaughey, leadership agency was Mid-Michigan Medical Center Midland, the medical floor. Goal is to obtain a position in an orthopedic floor or progressive care unit. Graduates Alpha Sigma Alpha and student of the Student Nurses Association member. Would like to thank family, friends for their patience, encouragement, kindness, and support throughout the journey. Her mother and father, she says, she couldn't have done it without you. Congrats. Samantha N. McPherson, leadership agency was Hurley Medical Center ICU. First RN position has been accepted at the University of Kansas Medical Center, Neurosurgical Intensive Care Unit. Graduates, summa cum laude, a Sigma Theta Tau International Honor Society of Nursing member, president of SVSU Student Nurses Association, and would like to thank her amazing parents, big sister, loving husband, entire family and friends for their never-ending love and support. Congratulations.
Darby J. Meineke. Her leadership agency was Mid-Michigan Medical Center in the Progressive Care Unit. Her first RN position accepted at Munson Medical Center in the Critical Care Nurse Residency Program. She's graduating summa cum laude. She would like to thank her mom and dad for being the most supportive parents out there. And a big thank you to Alicia, who has been there every step of the way. She couldn't have done it without you. Congratulations. Rachel Milks, leadership agency, McLaren Bay Region, Neurostroke Unit. Her goal is to obtain a position working in the Women's Health Unit in labor and delivery. She is graduating cum laude. She would not have done this without the constant love and support from her mom and dad, Ryan, Rianne, and handsome fiance, Caleb. Also, a huge thank you to her nursing school partner in crime, Abby, and her Lord and Savior, Jesus Christ. Congratulations. Brianna Ritter, her leadership was at Mid-Michigan Midland. Sorry, I'm so sorry. Alexandra Miller, I knew as soon as I looked at you, St. Mary's Emergency Room, Grayling Hospital at Munson in the Nurse Residency Program. She's graduating summa cum laude. She would like to thank her family, friends, and her incredible fiance for being so supportive and encouraging throughout the program and always being there for her. Congratulations, Alexandra. Madison Moore. Her leadership was at Mid-Michigan Health. Her first RN position is accepted at Vanderbilt University Medical Center in adult cardiology. She is graduating summa cum laude. She would like to thank her parents, brother, family, professors, and families for their continuous support over the past few years. She could not have done it without you. Congratulations. Jonathan R. Murray. His leadership was at Hurley Medical Center with a float pool. His goal is to work in the neurotrauma ICU. He would like to thank his mom, dad, and sister, and his buddy, Logan. Congratulations. Madison L. Offenbecker. Her leadership agency was Covenant Healthcare Harrison in the ICU. Her first position has been accepted at Mock Children's Hospital in the emergency department. She is graduating magna cum laude. She would like to thank her mom, dad, friends, and family for the continued support and encouragement, and for always believing in her. She loves you guys. Congratulations. Rachel E. Perkins, Leadership Agency, St. Mary's Neuro ICU. Her goal is to obtain a position in pediatric ICU. She is graduating magna cum laude, Sigma Theta Tau International Honor Society of Nursing. She would like to thank her supportive parents along with her professors, clinical instructors for helping her achieve her goals and giving her the confidence to become the student she is today. Congratulations. Abigail Peterson, Leadership Agency, McLaren Bay Region, Neurosurgical Stroke Unit. She has accepted her first position at Mid-Michigan Health, the General Surgical. She is graduating cum laude. She would like to thank her mom, dad for their constant support and faith in her through the good and bad. She would also like to thank her boyfriend for always believing in her and loving her. Congratulations. Logan Shea Raymore. Leadership was at Covenant Healthcare Harrison in the ICU. His goal is to obtain a position at Covenant ICU. He would like to thank his parents, uncle, grandma, Cindy, Martin, SVSU professors, and the leadership preceptor. Congratulations. Brianna N. Ritter. Her leadership agency with Mid-Michigan Midland Medical Oncology. Her goal is to obtain a position at Mid-Michigan or Covenant on the OB unit. She is grading magna cum laude, and she would like to thank her family and her friends for all their support. Congratulations. Emily Roberts. Leadership Agency, St. Mary's of Michigan, Trauma ICU. Her goal is to obtain a position in the neonatal intensive care unit or adult critical care. She is graduating magna cum laude, Sigma Theta Tau. She would like to thank her family, friends, boyfriend, Robert, and the wonderful nurses she has had the pleasure of learning from. She appreciates your support and encouragements and hopes to make you proud as she begins her new journey. Congratulations. Madison L. Roshan. Her leadership agency was St. Mary's Town Center in the emergency department. She's accepted her first RN position at McLaren Macomb Emergency Department. She is graduating magna cum laude. She would like to thank Erin for continuously supporting her throughout the entire program and her constant complaining. She would also like to thank her family and friends, especially Margaret. Congratulations. Marissa E. Rodriguez. Her leadership agency was Beaumont Hospital of Troy and the Progressive Care Telemetry Unit. Her goal is to obtain a position as a pediatric or neonatal unit nurse. She would like to thank her parents, siblings, Caleb, Cosmo, Angela Lynn, and the rest of her family and friends for encouraging and supporting her throughout her nursing journey. Congratulations. Morgan Y. Rombach. Leadership Agency, Hurley Medical Center, the Burn Unit. Her goal is to obtain a position in the Neurointensive Care Unit or in the PICU. She is graduating cum laude. She would like to thank her parents, Heather and Brian, her sister, boyfriend, and the rest of her family and friends. She is grateful for the continued love and support. Congratulations. Emily Rose. Leadership Agency, Mid-Michigan Medical Center, Midland Maternity. First RN position accepted at Spectrum Health, Butterworth. She would like to thank first and foremost her mom and dad for all their love and support, as well as making it possible for her to come to the university. She would like to thank her grandparents, friends, and professors for helping her to succeed. Congratulations. Bryn N. Sutter. Leadership Agency, Covenant CVICU. First position has been accepted at Ascension Providence Park Emergency Department. She is graduating cum laude. She would like to thank her parents, Nicole and Brian, her grandparents, and the rest of her family for all the support through her college career. Congratulations. Alyssa M. Sellers. St. Mary's Medical Center, ICU. She has accepted her first position at McLaren Lapeer OB. She would like to thank her parents, boyfriend, friends, and instructor for helping her along the way. Congratulations. Brooke C. Sarah. Leadership Mid-Michigan Medical Center, Med-Surg. Her goal is to obtain a position at Beaumont Hospital, Royal Oak on the cardiology floor. She would like to thank her friends, family, all the SVSU nursing staff, and 3 people who've stuck with her since N1. Lori Harris, Lorenzo Marco, Adam Majowski. She wouldn't have made it without any of you. Congratulations. Andrea J. Simon. Leadership, Hurley Medical Center, ICCU. She's accepted her first position at McLaren Port Huron ICU. She's graduating cum laude. She would like to thank her parents who have supported her through this journey, as well as her family, friends, the new and the old, and her boyfriend who always pushed her and gave her support. Congratulations. Natalie A. Steflia. Her leadership agency was Troy Beaumont Emergency Department. She's accepted her first position at Troy Beaumont Cardiac Progressive Care Unit. She would like to thank her parents for their endless love and support, and she couldn't have done it without them. She would like to thank her brother, boyfriend, friends, and family for their encouragement along the way. Congratulations. Joanne E. Stefanak. Leadership agency was Covenant Healthcare Orthopedic Surgical Floor. Her goal is to obtain a labor and delivery job by the end of 2018. She's graduating magna cum laude, Sigma Theta Tau, and Student Nurses Association. She would like to thank her mom and dad for funding her college education and supporting her dreams. Also her friends and family, then constant encouragement and laughter along the way. Congratulations. Elizabeth L. Stokes. Leadership Agency, Mid-Michigan Midland, PCU. She has accepted a position at Mid-Michigan Health, Maternity OB. She is graduating summa cum laude. She would like to thank her family of amazing nurses. Thank you for providing many years of excellent care to hundreds of patients. You have been her inspiration to pursue nursing. Congratulations. Jenna E. Thalen. Leadership Agency, Covenant Healthcare, Cardiovascular Progressive Care Unit. Her first RN position that she accepted is at Children's Hospital of Michigan, Detroit, Neonatal Intensive Care Unit. She is graduating summa cum laude. Thanks to God that she is achieving her dream. Thank you to her family, friends, and all who supported her along the way. Congratulations. Lane M. Thalen. Leadership Agency, Alda E. Lutz, Veterans Affairs. Accepted his first RN position at Beaumont, Dearborn, 5 South Cardiac Step-Down Unit. Graduating cum laude. He would like to thank his parents for being great role models and always believing in him, and his family for the endless support. Lastly, his fiancée, Monica, for the great advice and confidence she has given him and has allowed him to achieve his dreams. Congratulations. Kennedy P. Thomas. Leadership Agency, Mid-Michigan Health, Midland. First RN position has been accepted at Beaumont Royal Oak Neuroscience. She's graduating cum laude, a 4-year varsity softball athlete at Saginaw Valley State University. She would like to thank everyone who has supported her along the way, especially her mom, dad, brother, and Bubba. She couldn't have done this all without you. Congratulations. Alicia M. Tomlin, Leadership Agency, Mid-Michigan, Midland. She has accepted her first RN position at Sparrow Hospital, Lansing Med-Surg on the step-down unit. She is graduating cum laude. She would like to thank her parents, dogs, friends for being so patient with her and supportive of her, especially Darby by reminding her to turn in assignments, and the lunch that she left on the counter every clinical week. Congratulations. Keen L. Troutner, Leadership Agency, McLaren Bay on 4 West. His goal is to attend a nurse residency program and BSN to DNP program. He would like to thank Cody, Craig, Susan, Kayla, his grandparents, his professors, his nursing friends, Luke, Gonzo, and anyone who helped him along the way. Congratulations. Morgan L. Verbal, Hurley Medical Center Neurotrauma Intensive Care Unit. Her goal is to study hard to pass the NCLEX and then accept a job in an ICU setting. She is graduating cum laude. She would like to thank her family and friends who have supported her throughout this journey. She would also like to thank her preceptor, Aaron York, for teaching her how to be the best nurse that she can be. She really appreciates you. Congratulations. Cassie A. Walker, Leadership Agency, Mid-Michigan Medical Center, Gratiot. Her goal is to obtain a position at Mid-Michigan Medical Center, Gratiot, in the emergency department as a graduate nurse. She would like to thank her family for their unconditional support, and she couldn't have made it this far without them. Congratulations. Carly M. War, Leadership Agency, St. Mary's. Her first RN position has been accepted at Covenant Healthcare Moderate Progressive Care Unit. She is graduating cum laude. She would like to thank her parents for all the support throughout these past 4 years. She couldn't have done it without you. Congratulations. Rachel M. Webb, Hurley Medical Center, Float Pool. Her goal is to obtain a position in critical care or labor and delivery. She is graduating cum laude. She would like to thank her parents, grandparents, brother, boyfriend, and all of her friends in nursing school have experienced this wild journey with her. Congratulations. Lindsay R. Weber, Leadership Agency, McLaren Bay Region 4 West. She's accepted her first position at Munson Medical Center, Critical Care Residency. She's graduating summa cum laude, honors program, and the President's Scholarship. She would like to thank her parents, family, professors, and friends for supporting her throughout this challenging journey. She couldn't have done it without you. Congratulations. Kiara S. Wilson, Leadership Agency of St. Mary's. First RN position accepted is at Covenant Healthcare OB. She's graduating magna cum laude, Student Nurses Association member, and Founder Scholarship recipient. A huge thank you to her amazing family and friends for the continuous love and support, and a special thank you to her mom and sister, Keegan, for always listening and returning her that everything will be okay. Congratulations. Emily R. Winkley, Leadership Agency, Covenant Healthcare. First RN position accepted as a Covenant Healthcare Emergency Care Center. Graduating cum laude, Student Nurses Association member, member of the National Society of Leadership and Success and the National Society of Collegiate Scholars. She would like to thank her family and friends supporting her through nursing school, and her Nana in heaven for inspiring her to become a nurse. Congratulations. Elena Wright, Leadership Agency, Children's Hospital of Michigan, Burn Rehab Unit. First RN position has been accepted at University of Michigan Hospital on the Orthotrauma Unit. She's graduating cum laude. She would like to thank her parents, sister, papa, and boyfriend for their love and support they've given her throughout the program. She couldn't have done it without them. Congratulations. Congratulations to everyone.
To our RN to BSN and to our undergraduate students, it's truly been an honor to have you in class, and we celebrate and appreciate you today. So let's give them all a round of applause. Please know how very proud we are of you and so happy for you. At this time, to bring our closing remarks, we're going to bring Dr. Andrea Frederick.
So we want to be sure that everybody knows that you're invited to commencement tomorrow night, okay? So come to commencement. You also have punch and cookies hidden behind the curtain back here. But we get to tell you what to do one more time, okay? One more time. For the next 2 weeks, relax. Whether you were an RN to BSN student or a BSN student, we want you to relax because now you're a graduate. And after that, you only get 2 weeks. If you're an RN to BSN student, I want you to think about coming back for your master's degree somewhere. Keep learning. For the BSN students, oh my goodness, you've got to prepare for the test of tests, okay? So seriously study. But right now, it's time to celebrate and get ready for your next step. Before that next step begins, I want you to just a moment look at your hands. All of you, all the graduates, look at your hands. In my mind's eye, I'm still 35 years old. Now, hey, don't laugh. I realize that ship has sailed now decades ago, but when I look at my hands, what I see are the hands of my mother and my grandmother, and I realize that they're hands that have lived a life. They're a little bit dry, they're a little bit cracked. My nails are cut very short. I never wear jewelry on my hands. I've never had a manicure. That's because of years of hand hygiene. You too can have hands like this. But when you look at your hands, I want you to think about what those hands are going to do. You're going to start an IV on the very first shot. You're going to become the nurse that's the one everybody goes to start the IV. You're going to pass an NG to make the patient feel better, and they will feel better. You're going to help a laboring mother and then get the honor and privilege of holding her newborn. You're going to comfort patients and their families when the news is not good and when the news is good. You're going to provide excellent patient care in the OR, the ER, in ICU, med-surg, quality department, public health department, case management, and the classroom. With your hands, your head, and your heart, you're going to provide safe, evidence-based, outstanding care to your patients and your communities. We can't wait to hear about all that you accomplish. So please come back and tell us your stories. Never stop learning. Your SVSU faculty and staff, your families and friends congratulate you on your accomplishments. You've accomplished a lot, but the road has just started. Now, get out there and do great things. Congratulations. The photographer's going to stay here and take pictures, and as I said, behind the curtain is punch and cookies, so go have some.